It's informative. It's healthy. And it's the news. Welcome to the Health Connection. Welcome to this week's special episode, New Year, New You.
Hello, everyone. Thank you so much for tuning in to the Health Connection. First, I'd like to wish you all a happy new year. It is 2021. We have a lot to discuss on this episode. I am joined with two very special guests, and I would love to introduce you to them. First, we have Dr. Marisela Watanabe. Please tell us who you are.
Hi, I'm Dr. Watanabe. I'm one of the family medicine physicians at the Little Havana location for Care Resource. I've been with the organization for the past 4 years. I'm really excited and looking forward to 2021, along with all of you guys.
Thank you. And we also have, not doctor, but we have Gloria Cabral, registered dietitian. Please let us know who you are.
Hi, thank you so much for having me. I'm Gloria Cabral, registered dietitian nutritionist. I am the one and only registered dietitian at Care Resource, so I kind of take care of all the clinics, and I'm really glad to be here. It's a new year. I'm really excited for 2021, and hopefully, this will help you guys start off the year, in a really good way.
Again, thank both of you for being here, and I look forward to hearing what it is that you'll be sharing with the viewers, and I will also be utilizing some of these tips myself. So the topic is all about nutrition and wellness for the new year. It goes without saying, 2020 was pretty tough on us. However, let's move forward and let's do better in 2021. And the first topic that we will start with is New Year, New You. First question is the new year the best time to schedule an annual exam? I'm going to start with Dr. Marisela.
So yes, for many of us, the new year, like you said, is a time to kind of reflect on the past and reset, right? Start afresh. So many of us come up with resolutions, and that is great. But most important is to maintain these. And when it comes to health, your medical clinic can serve as a great support. And as far as annuals go, if you had never had one, well, maybe this might be a good time to schedule. But if you've already had one last year, then maybe we can you can connect with us, and we can assist you with other questions and reminders as to when your next annual visit is projected for. Again, like your annual exam is an opportunity for you to discuss a lot of things with your provider. Some patients may need more than just a once a year exam and whatnot. So it all depends on the individual person.
Awesome. Thank you. Gloria?
Yeah, so it's definitely like Dr. Watanabe was saying, it's a great time to schedule your annual visit. And then also, once you see your primary care provider, if you are interested in getting a one-on-one nutrition consult, then you can always, it's a great time to ask for a referral. And that way you can get personalized guidance to help you, achieve your goals or your health or your nutrition goals for the year. So it's definitely a good place to start.
I hear that, and I thank you all for sharing that. So aside from scheduling an annual exam, many of us have been home in 2020, and a lot of us are still at home because we're scared to go to the gym. So next, my guests are going to share how to get active.
A lot of us are working from home, and it is important to remind ourselves to get up and moving, right? Any activity is better than none. I wanted to just kind of remind everyone that Per American Health Association, the recommendation is to get at least 150 minutes per week of moderate intensity aerobic activity, or 75 minutes per week of vigorous aerobic activity. That's preferably spread out through the week. So however you want to cater it to your schedule, half an hour, 5 days a week, or more intense, like hour, 2 to 3 days a week. I'll open it up to Gloria.
Right.
Yeah, so building up on what Dr. Watanabe said, it's really important to get that physical activity in, especially for a year where a lot of us were sedentary, and a lot of us are still exercising at home, right? It's not like New Year and everything changed, unfortunately. So we're still, going through it. And exercising at home can be very convenient, but it can also be very easy to procrastinate. So really try to set yourself up for success. There are some tips that I recommend for exercising at home. One of them would be try to get a schedule, make a plan, same as you would do if you were going to the gym or if you were practicing a sport. So for example, get a planner or put it on your fridge. Mondays and Wednesdays, I'm doing upper body for 30 minutes at 5 p.m. So it's something very specific. It's easier for you to follow, and it gives you some accountability. You could set up an alarm even, so that way at 5 p.m., that's when I'm exercising, and you have that extra reminder. Also, try to set smart, attainable goals. So things like, it can be something very simple, like, every week I'm going to do 5 extra lunges. So that's something that, is challenging you, is motivating you. Another tip that I recommend, get on, your workout clothes, your shoes. Just get dressed like you were going to the gym, right? So that really motivates you, puts you in the mindset of exercising. Another thing that I recommend a lot is trying to get an exercise partner. It could be somebody you live with, or it can be even somebody that you can call via video call. I actually did it a couple of times with friends or with like my cousins. So you can work out together, motivate each other. It's a lot easier to not make excuses if you've already made arrangements to exercise with somebody, right? Another thing that I think that it's really important is trying to find something that motivates you, something that you enjoy. So it could be weightlifting or something like Zumba or martial arts. There's a lot of apps, a lot of websites, YouTube, magazines where you can get a lot of information. Make sure that these are professional sources, and make sure that you're looking at the pictures and the videos. That way, your posture is correct. You avoid getting injured. Okay, that's really, really important. If you're doing something like Zumba, you could do like an Instagram live video, you could do YouTube. So it's something like having a personal trainer with you. And I think that that's super, super fun. One of the downsides is, of course, you might not have enough space, or you might not have the same amount of equipment that you have at a gym, right? But there's a lot of things that you can do, get creative. If you have a yard, if you have a balcony, use that. For weights, for example, water bottles filled with sand or with rice, or even water work as weights. Something that I like to do is I'll get a backpack, I'll fill it with books, and I'll put it on my back. So if I'm doing lunges or squats, it's really great. It works really, really well. And then last but not least, if you are starting something new, some exercise that you've never done before, or if you have medical conditions, check in with your medical provider at Care Research to make sure that you're doing, the type of exercise that's correct for you.
Well, I feel like we're all going to get in better shape after that information. Honestly, that was really not only informative, but also it's great to just take advantage of like what you already have. Like the whole weights in the backpack, that I thought was just being resourceful. So I appreciate that. And while people may believe that exercise is all it takes to get fit, it's really important to elevate your plate. So, which are the best times for meals throughout the day?
So that is, there's no perfect answer for that. And sorry for jumping in and talking about this directly, but there's really no perfect answer for that, because, meal schedules should be personalized to meet, your schedule and your lifestyle, right? There are some things that I do recommend, related to, what's the best times or how to schedule your meals throughout the day. Definitely the first thing, don't skip a meal. Okay. Try not to eat, and try to eat at the same time every day, right? If you skip a meal, you're going to be hungry, and then you're going to be more likely to overeat or just eat anything that you find in the fridge or order out or get junk food, right? So definitely, plan ahead. If you know that you're going to have a late lunch, pack a snack, have something that you can eat, okay? Trying to eat at the same time every day also helps, because it helps your body get used to that meal schedule. So, you won't get as hungry in between the meals. Okay, so that's something that I think is helpful also. If you're somebody that's used to snacking, or you feel like you're eating throughout the day a lot, plan your snacks. So a good time to plan a snack is about 2 to 3 hours after a meal, because that's when your sugar levels start to drop. So you could, same thing, like I said, plan ahead. You can also put in an alarm. I have a lot of people that tell me, I'm working from home, I'm stuck to the computer, I forget to eat. Put an alarm, and then that way, you'll get that reminder, and you'll be able to eat kind of at that same time every day. Another thing that you can do is, try to eat within a 12-hour window. So, for example, if you have breakfast at around 8 in the morning, then have dinner before 8 p.m. So having that 12-hour window helps you kind of, schedule those meals in between. And there's also a lot of studies that have shown that it's beneficial, especially for lowering blood pressure and improving insulin sensitivity in people with chronic disease. So it could be something, to help you. And finally, try not to eat, 1 or 2 hours before you go to bed. So those are just some things that you can do to kind of plan your meal schedule.
Wow, thanks. Dr. Marisela, can you please add anything onto that?
No, I mean, for sure. We have Gloria delineating a lot of the things that are very important, right? To maintain kind of a good habit, right? It is a step-by-step process. A lot of people go on a lot of diet kicks right now as a new resolution to lose weight or whatnot. But it is important to keep in mind that whatever changes you're making right now is kind of a long-term game, and that you're going to be able to maintain that throughout. So definitely, kind of find what works best for you. And also remember to hydrate and stay hydrated. Water is an essential part of our well-being. So when you're home, remind yourself to take that trip, walk to the kitchen and get a glass of water.
Yes. Water is everything, especially if you're going to eat and exercise. You must be hydrated. And another huge important part of not only exercise and fitness, also just your immune system, is making sure that you rest and relax. What solutions can you all provide on improving the quality and the quantity of sleep? Who would like to go first?
I'll go with that. Well, depending on your age, you may need more or less sleep, right? Typical adult ideal average would be 7 to 8 hours. And the amount of sleep is important, but the quality of sleep is also contributing to your overall well-being, right? A good night's sleep is essential to feeling rested, energized. And in order to help with this, it is important to identify any underlying causes that may be contributing to the lack of quality sleep, as well as developing healthy sleeping habits, right? An important sleep habit would be to disconnect from our iPhones or phones, iPads, TVs 2 hours prior to going to sleep. That is something that a lot of us kind of are doing right before we go to bed. And it really tricks your brain to kind of staying awake, right? Also, sleep is closely tied with the other elements of health, like you said. And, the more we exercise, the better we eat. All of that is also going to be part of eliminating stress and improving our sleep and helping us with boosting our immunity.
I hear that. Love the tip about the 2 hours in the shutting out, though. Want to try that, and I'll let you know how it goes.
Definitely.
Gloria, would you like to add anything to resting and relaxing?
Yeah, so like Dr. Watanabe was saying, it's all, I feel the same, it's all intertwined. So, like we were talking about, having that meal 1 to 2 hours, that last meal of the day, 1 to 2 hours before
Right.
you go to bed is really important. And then adding that exercise is also really important to make sure that you're getting that quality and that quantity of sleep.
Yeah, I agree. The meal 2 hours before laying down, a lot of patients suffer from acid reflux and whatnot. And that is one of the recommendations that we have to minimize those kind of symptoms, right? As well as just allowing the digestion to occur. And your last liquid, like the last drink that you have, to be also within like 2 hours prior to going to sleep. Because sometimes if we drink right before going to bed, what wakes us up in the middle of the night is having to go to the bathroom, right? And once you go to the bathroom, you come back, and then that's when the struggle begins sometimes. So it's another like little tip to kind of
Because it's somewhat difficult to get back into sleep after you've woken up at like 3 a.m. and then you have to wake up at 6.
Exactly. You're already kind of, thinking about it and whatnot.
Exactly.
And finally, I mean, for people that happens, another thing to consider would be like if you spend, half an hour already in your bed and you are just not able to sleep, I would highly recommend just stepping out to another room, going to the couch. Do not turn on any of your electronics, but like if you need to like read a book or something, that's fine. But try to kind of cut that cycle of I'm in bed and I can't sleep. I'm associating my bedroom with the fact that I can't sleep. So in order to cut that cycle, like making sure to like remove yourself from that space if it's been 30 minutes or so and you're still struggling.
Well said. Thank you again. The final part of this episode is actually going to be about New Year's tips. So, keeping in mind that our viewers are making New Year's resolutions, they're going to the gym or working out at home, they're trying to eat better, they're trying to rest better. What are some tips for the new year that will set them up for success? You've mentioned some stuff, but I'm sure there's a lot of other information in terms of encouraging them to stay on track. What are some things that you all would be able to mention to the viewers?
Yeah.
Want to go first, Dr. Watanabe?
Go ahead.
Of course, of course.
So no, I just wanted to say, we talked about a lot of things today, I think, but I think it's really important to set yourself up for success. So, don't try everything at once. Start with 3 to 5 maybe goals, smart, attainable goals. So things that that you can achieve, and then stick to those before working on other things. So smart and attainable goals will be things like, you have a time frame, you have the goal, you have maybe even a time. So it could be something as simple as I'm going to start eating, 2 cups of vegetables at least 3 times per week. And I'm going to do it, every single week. So that's, you have a time frame, you have an amount, it's very specific, okay? And then, do that and maybe 2 or 3 more things. Once you get those down where you're doing them consistently, then work on 3 to 5 other goals. And that way, you're setting up yourself up for success and you're not doing everything at once. And then you're overwhelmed by February and then you stop everything.
Totally agree with Gloria. I mean, would take one step at a time towards your health goals, right? Ensure a broad balance, physical, mental health, stepping back, assessing these categories. I am very hopeful also about 2021, especially with the COVID vaccine becoming available, right? Vaccine is currently starting to be distributed to adults over the age of 65, high-risk patients, healthcare workers. Also, remember, When we're talking about immunity boost and whatnot, it is flu season. So it is a good time to get your flu shot. Make sure you consult your provider and review, if you're up to date with your vaccines. And I would say one of the last tips, while the pandemic is still raging, be responsible with social distancing and continue to mask up.
I thank you all. All of that, every single bit of information that you all shared with us was valuable and helpful. And like I said earlier, I will also be utilizing these. So I personally thank you for joining us. And I do hope that the both of you will join us again in the future for another episode of The Health Connection. This is happening once a month. And we all want to stay healthy. We all want to improve. So I thank you all for giving us all this information on nutrition and wellness. We will see you all again soon. Any last words before we sign out?
Thank you so much.
Thank you so much for having us, and hopefully we'll be here again.
Please, thank you so much. Viewers, you're great. You're awesome. This has been another Facebook Live with the Health Connection from Care Resource. Take care of yourselves.
Don't forget to like us on Facebook at facebook.com/Care Resource, or follow us on Twitter at Care Resource FL, or subscribe at youtube.com/Care Resource. For more information or to find a location near you, visit us online at careresource.org.